Okay, this is Marty Wilson speaking. It's October 26, 2023. We're at the Monroe County Historical Association's temporary headquarters. And we're talking today with Dr. Sherwood Samet about several things, as we'll find out. And sitting in the room is Holly and Amy and Tanya. So let's start with where and when you were born.
1927, way back in Brooklyn. But early on, family moved to northern New Jersey, towns of Verona and Caldwell. That's where I grew up. And got to the Poconos because of medicine. I was in medical school at the University of Pennsylvania, and between our last 2 years, the summer between our last 2 years, we had to spend working in some medical facility. And so the year before, one of the doctors, the medical students who was a year ahead of me, had spent a summer up here. And he told me about Pocono Hospital, and he thought it was a great experience. So I asked to come up and spent the summer here.
What year was that?
1953. It was like the Middle Ages compared to today.
What was the physical plan at the hospital?
There was, the new hospital had just been built in 1951. There was a wooden wing in the back. I can tell you an interesting story about that, but there was a modern part. There were 4 stories. SS Kresge had donated money for the 4th floor where the operating room was, and it was a nice facility. And I thought, I'm going to come up and teach these country doctors what it's really like. And I was amazed at the quality of care that was provided by the doctors who were here. Not all of them, but most of them. And that's what eventually got me interested in coming back here to practice.
I wonder if, do you remember in terms of size, I mean, how many doctors there are today? And
There were about 39 doctors in the whole county, and you knew everybody. You knew them by first name because they'd refer patients, and you'd call them up and talk to them person to person, not like today. So it was a good time for medicine. I think today the doctors are much more knowledgeable, but I think they've lost a little bit as far as the doctor-patient relationship. So,
did you work solely at the hospital, or did you have a private practice?
That summer, they rotated us through surgery, medicine, and obstetrics in the emergency room. And the first day I got here, Dr. Jordan, who was chief of surgery and sort of ran the hospital, said, "You're in the OR." And I didn't know anything. It was an experience, a learning experience, and I'd see a patient and I wouldn't be sure what to do, and I'd be on the phone and talk to a doctor. So they did not have emergency room staffs. The emergency room was staffed by the doctors on the medical staff, and they took turns, and that lasted for a number of years, actually.
So at this point, you're a generalist. You haven't...
No, at that point, I was still a medical student.
Okay.
Yeah.
So that summer, then you went back to finish one more year?
I finished, and then I wound up marrying the daughter of one of the doctors, and she was finishing school at what is now ESU. So I then worked for Dr. Jordan for a year between my internship and my residency. And at that point, I saw that the obstetrics they were they needed somebody in obstetrics, and that's what prompted me to go and do a residency, and then come back here and practice. But I was kind of stupid because I didn't realize you didn't do obstetrics alone, which I came back and did, and I was on call straight for 3 years. So it was a busy time. In the beginning, when I first started, July 1st, 1959, the general practitioners hated doing obstetrics because it took them out of the office a long time when patients were in labor, and they didn't want to give it up because if they referred the patient to another family practitioner, they would wind up losing that patient. So the day I started, about 7 or 8 of the family practitioners stopped doing obstetrics. So I was busy, really busy from day one. And I think the first year I delivered something like 200 babies, and then the next year maybe 350 or something like that. So it was, and you know, it was day, night. I was never home.
You must have delivered half the population of Monroe County.
Yeah, I did.
Do you have any idea over the course of your career how many?
I never really counted, but I would guess it was maybe close to 5,000.
And so when you come back and you go into obstetrics, did you open up a private office where you?
Yeah. In those days, you didn't join groups. You opened up your own office, and I had an office on Crystal Street in Stroudsburg, East Stroudsburg, across from the station. Funny story about that. I moved into an office that had been vacated by a pediatrician who left town at that point. And I'd had all his equipment, and he had a pediatric scale that went to 200. And I was seeing OB patients, and I had a lot of patients from the West End, farmers' wives who were well over 200. So I made an arrangement with the station master, and they'd weigh them on the freight scale and send them across the street. Now, if you tried that today, they'd shoot you. But they didn't. The patients didn't seem to object to that. So.
Yeah, Monroe County in the 50s and 60s.
Yeah. And the train station was still operating. I mean, the trains were going to New York and the other direction, Scranton. And I remember once just walking to the station with a suitcase and going to a meeting in Chicago, taking the overnight train and waking up the next morning in Chicago. It was really nice.
Yeah, I think we all miss that.
Mm-hmm.
Yeah, so then at some point you get into art, the photography.
Yeah, just by accident, and I got I think somewhere around 1975, 74, I got a camera and started taking pictures, and one of the other doctors had a dark room, and he invited me over, and I got interested, and I wound up building my own dark room, and had a bunch of shows, and I look back at that first show that I was so proud of then. It was awful. I mean, I would not show any of those pictures today.
Where was the show?
At the courthouse. Okay. And I was told by the judge, no nudes or the whole show comes down.
So I'm trying to picture a physician as busy as you were. When did you find the time to do the photography?
Well, after I gave up obstetrics and just did gynecology. But one interesting thing, I was seeing patients from all areas of the county because there were no highways out of the county at that point. And I was seeing a lot of pregnant teenagers from all school districts. So I thought it would be a good idea if they had a little sex education in the high schools, which they didn't have. Actually, we didn't even have sex education in medical school. That's how dark the ages were then. So one school board meeting in East Stroudsburg, I had written a curriculum for what I thought should be in a program, and I went and made a presentation to the school board at East Stroudsburg. Pauline Peterson, I think, was the superintendent at that point, and I made my presentation, and they said, well, we're going to vote on whether we do this or not at the end of the meeting. And she said, you're welcome to stay. I said, I'd love to, but I have a 12-year-old in labor now. And that sold them. They voted for it. And I really did. I really did.
Wow.
So it was...
As a gynecologist, was there any pushback from the community in dealing with teenage pregnancies in any way?
No, not really. I wound up doing arranging a lot of adoptions, and that was sort of fun.
Not something a gynecologist normally does, though, right?
No, but there was nobody else around to do it, and I had access to these babies that these young patients didn't want. They'd come up from the city, deliver, and go back home.
So a lot of your patients were from out of the area?
And from in the area also, yes.
Yeah.
I remember one time and at times I had trouble finding parents to take the babies, and I one time I had 3 babies in the nursery that were awaiting adoption, and the hospital administrator, Harry Smith, said, you got to get them out of there. He said, I can't afford to feed them. I said, well, I'm not taking them home because I got 3 of my own. You'll just have to wait till I find somebody. So,
Was there some kind of social agency that was helping you with this?
not that I'm aware of. Not that I'm aware of.
So you took
There might have been, but what we do is have the adopting patients get a lawyer and arrange it, and everything was perfectly legal, and the only fee that I got for it was my regular delivery fee, which the adopting parents paid.
So the pregnant girl would come to your office, give birth, and then walk out the door, and that's it. Wow.
Actually, one time when the trains were still running, there was a girl who was a student nurse at Margaret Haig Medical Center in Jersey City, and she was going home for the weekend to see her parents. And she was a big girl, and she went into labor on the train. And by the time the train got to East Stroudsburg, the conductor said, you got to get off and go to the hospital because I'm not going to deliver the baby on the train. So she came to the hospital, took about an hour and a half, and I delivered her. And I went to see her in her room afterwards, and she was getting dressed. I said, where are you going? She said, I got to go home. She said, my parents don't even know I'm pregnant. So I said, what about the baby? She said, it's yours. So we wound up finding...
There weren't laws against that at the time? Or maybe they're not now, I don't know.
There might have been, I don't know. Maybe I broke some laws and I'm not aware of it.
Huh.
Yeah.
Hard to imagine.
Yeah.
Well, you must have seen quite a change in the medical profession over the years.
When I look back, and the change of the way medicine was when I started and the way it is now, it's just revolutionary. And I think the doctors know so much more now, but as I said before, that I think they've lost that doctor-patient relationship.
Well, what are some of the other big changes that you recognize?
People died of heart attacks from arteriosclerosis. Now they put stents in. It's like routine, and you don't die from that. I remember Dr. Metzger, who was a really good general practitioner when I first came here, delivered a lot of babies, and he delivered babies at home because patients didn't want to go to the hospital. And he said there were a few times when I told patients, if you don't go to the hospital, you're going to die. And they said, I still want to be home, and they died. They wound up dying. So it's, even though this country has a poor maternal mortality rate compared to other advanced countries, it's still a lot better than it used to be. So
You must have retired before the consolidation. That we no longer have Pocono Hospital essentially.
Yeah. Actually, it got to the point, I got to be medical director of Pocono Hospital. I did that for about 7 years, and in retrospect, it was a mistake because you're sort of having to control unruly doctors, and you were the liaison between the non-medical staff and the medical staff, and part of it was fun, and you did quality review studies and things like that, but there were always a few doctors that didn't want to obey the rules, and so you had to be tough on them. So but it was before Pocono was associated with Lehigh Valley, and then I finally gave that up, and at that point I hadn't done surgery for about 7 or 8 years, so all I did was office practice, and at that point it was economically unfeasible to do just office practice and not surgery. Didn't have enough to pay the bills, and so you wound up, I tried to set up a program with Pocono. I went to the administrator and wanted to set up a program for postmenopausal women, like one-stop shopping, where they'd come in for mammograms and ultrasounds and in one shot. And he didn't want to do it, and I went to St. Luke's, and the St. Luke's obstetrical group wanted me to come there, but the administrator, it was politics. The administrator said no, because at that point Pocono was sending them their heart surgery, and he didn't want to mess that up. Then when Pocono eventually wound up doing their own heart surgery, he said, the heck with them, let them come down. So I joined St. Luke's OBGYN group and just did gynecology. I didn't go back to doing obstetrics.
Do you remember what year roughly this was?
After a while it gets to be a blur, but somewhere around
but how,
1990 maybe.
Okay. Well, how do you feel about the consolidation as a physician? What's your perspective on it?
I think it's necessary, and there are a lot of pluses, but you lose a little bit. And I think the thing you lose most is the doctor-patient relationship. And doctors are under pressure to see a certain amount of patients, and maybe that leads to mistakes. things that are overlooked.
Hmm.
I don't know. I'm glad I'm not doing that anymore.
Yeah.
So, but it was it's interesting to look back and see the changes. Same thing with photography. It's gone from the darkroom to digital. I mean, and I remember in the darkroom thinking I'd print a picture and it wouldn't be right, and I'd print it 6 or 7 times, and I thought there ought to be a way that you can see what it's going to be before you do it. And now there is, and it's so easy. And the old time photographers were great. They were really great, but they would be so envious of what we're able to do now with photography. Just unbelievable.
Well, people carry around cameras in their phones.
Oh, right.
It's completely different.
And as I've gotten older and like to carry less, I carry my phone and not a camera. So.
But before we leave the hospital, you were chief of staff? Is that what your position was for 7 years?
Oh God, let's see. I was here 2 months, and Marshall Metzger said, "You're head of obstetrics." And so I was telling doctors who were 20 and 30 years my senior, "You really shouldn't be doing that. You ought to be doing this way." And they'd pat me on it and said, "Okay, Sonny, we'll try." But I eventually got through to them. But I was chief of obstetrics for about 15 years, and then I was chief of the medical staff for 3 years. And then was the first paid medical director of Pocono, and I did that for about 7 years. So.
Were you involved in any of the fundraising to expand the campus over there?
A little bit. We'd have to go out and talk to groups and things like that. Not directly in the fundraising. I didn't really have to ask people for money. That's not a good job.
Some people are very good at it.
Yeah, they are. One thing I should tell you about, I was here during the flood of '55. That was the year that I worked for Klaus Jordan as a junior member of the surgical staff, and I was on first call in the ER the night of the flood. I lived about 3 blocks from the hospital, so I was at home, and I did not have one call all night because nobody could get to the hospital. The bridge was out. The Interborough Bridge was out. The bridge was out at Stokes Mill. The bridges up 209 and Bushkill were out. So East Stroudsburg was isolated. And when I walked in the hospital that morning, the hallways were filled with beds and people. And I thought, gee, somebody had a bad night. And they were people who were flooded out, and this was just a place they were allowed to stay.
Oh, they weren't patients.
They weren't patients. They were victims of the flood.
And that's the first inkling you had that something had happened.
Right. I was just married. We were living with my in-laws, and my mother-in-law said, "I hear screaming," and we said, "Oh, you're crazy." But there were people down at the bridge when the bridge went out. So we lived on South Green Street, which wasn't very far from the Interborough Bridge.
Yeah.
So.
I imagine the next few weeks, months were pretty hectic.
Well, it got hectic. The what is now the softball field for ESU was the landing field for helicopters from Tobyhanna Army Depot, and that's how they brought patients in. A lot of people got helicopter rides. I never did. But it was my eldest son was a month old at the time, so he and his mother got flown by helicopter to Stroudsburg, and they borrowed somebody's car and drove down and stayed with my parents for 6 weeks till the place got back to normal. But
Well, before we leave the hospital, did we cover all the positions you held there at the hospital?
yeah, one thing that I could probably talk about is when the Supreme Court okayed Roe versus Wade.
Oh, yeah.
I was doing abortions in the office. I was picketed, had death threats, wound up eventually working for at the Allentown Women's Center, like 1 day a week, doing abortions for them. And there were a lot of protesters down there. My first day down there, they gave me a bulletproof vest, and I thought, this isn't so much fun. But I wore it for like twice, and it was so hot. I said, "The heck with it. They could shoot me if they want."
Before Roe, were you approached by women for abortions much?
Oh yeah.
Without
And
incriminating.
we actually did some before then, because what would happen, the women would say to the psychiatrist, "I'll commit suicide if I have to have this baby," and then she would testify that it was necessary on that basis, and we did a few that way. But they got, as time went on, they got so much safer, and with the advent of ultrasound, you know exactly what you were doing. So it was probably the safest procedure done today.
Did you ever have to deal with the fallout from somebody in a back room? You know, you hear these stories about women trying to, induce their own abortions.
Oh, when I was a resident, I did my residency at Harrisburg General Hospital in Harrisburg, and we would 2-3 times a month get patients in who had illegal abortions come in with massive infections, bleeding, had a few of them die, despite everything we tried to do. It was a common thing.
So as a physician, you were happy to see Roe, I assume.
It was right from the beginning. In the beginning, a lot of the doctors did not want to do it, but they were happy to have someone present who was willing to do them and do them safely. So, it got, after a while, groups got actively campaigning against them.
Campaigning against abortion.
Against abortion, just as they are today.
Yeah. Were you the lightning rod in the county? Did you ever feel, other than that, having to wear a bulletproof vest?
Because I was basically, there were, initially the other members of my group were doing them, and then 2 of them opted out of doing them, and then the third one did. So I eventually was the only one in the county doing them.
Did they opt out because of the community pressure?
One opted out because of his religious beliefs. The other one eventually did, and the third one became a born-again Christian, and so I guess it was religion that got them all out.
Wow.
Interesting time.
Yeah.
Interesting time.
Did you ever feel threatened? Did you ever feel?
Other than being yelled at by pickets, no.
I would imagine things would be different today, with the social tone today.
Oh, and with the availability of guns, yeah, very much so.
So you had a fairly huge private practice and you worked at the hospital.
Oh, yeah.
When did you retire? Or are you?
When I was 87. Yeah, at the end I was just doing office gynecology. And I was interesting. I saw a patient that Dr. Klaus Jordan took care of in 1953. And she had an unusual condition. It was gynecologic, and she was 13 at the time. When I came back to practice, starting in 59, 6 years later, her mother walked in the office and said, "You don't remember me?" I said, "Yes, I do." I said, "How's your daughter?" He says, "She's pregnant and I want you to take care of her." And she had had half of her uterus removed because of the condition that she'd had previously. So we wound up having 3 babies together, and she was still a patient when I resigned at 87.
So you delivered, well, you dealt with mothers, daughters, granddaughters?
Oh, yeah.
No kidding.
Oh, and I took care of patients who had things they didn't want their mothers to know, and the mothers were also patients. So, and they'd ask me, and I say, I can't tell you that. So it was kind of fun.
Well, it sounds like you had a career that had a huge impact on the county. I mean, you must be familiar with many of the. Well, you said you gave birth maybe to 5,000 people.
Yeah. Well, I still meet people on the street that I don't quite recognize, but they look familiar. And I'll say, "Do I know you?" And we winds up having been a patient, and I get a hug and a kiss.
No kidding. Yeah. 87. 87.
Yeah.
You just loved it so much you didn't want to give it up?
The thing I liked about it most was the doctor-patient relationship. I mean, I saw patients long enough that I didn't have to look at the chart. I knew their family history.
Are there still doctors like that out there, do you think?
There are probably a few around.
Yeah. So let's get back to the photography then. When did you decide to start showing? When did it become so important in your life?
Well, I guess I had a pretty good ego, and I thought I was good right from the start. And I just enjoyed trying to make better pictures. At this point in my life, I don't want to have any more shows. I make pictures for me, and it is really fun working on something. Could be for hours, could be for days, but when I produce something that I think is really good, I look at it and say, "Gee, did I do that? That's really good."
Can you define good? How do you mean? I mean, to you, what is good?
Pleasing to the eye, good composition. It's hard to describe. You
were one of the first to start using computers to alter the image.
Oh, yeah. I remember I had the show that I sold the most was the first computer-generated, where I had computer-generated images. and that was at the Duto.
Oh, yeah.
And I wound up selling like 18 or 20 prints in one show. Now, if you have a show, maybe you sell one, you know. So you're doing the show for yourself and not for really anything else.
All right, is it all computerized today for you, or do you still go in the dark room?
Oh, nobody works in the dark room. I mean, there may be a few, but everything you see today now with AI, we had a group meet yesterday, and one of the photographers had a picture of an old train trestle. So he used AI and said, I want an old train on the trestle. And he pressed a button and the old train was on the trestle. I mean, so you really can't believe anything you see in pictures anymore, and that it was really like that.
There's a sort of element of artificiality about it, though. Is that concerning, or it's just?
Well, I had what was in my 65th medical school reunion. We had to send a picture in, so I photoshopped my face to make it look a little better before I sent it in.
So you've had a fascinating career as an artist and as a doctor. Did you mention athletics before we started this interview?
Well, I'm sort of a jock from way back. In high school, I was in track football. Played football for a year in college till I got a bad concussion and couldn't read for about a week because everything was blurry, and I thought, I better not do this. And I wound up in track and cross country in college, and then I went to Johns Hopkins University undergraduate school, and I learned to play intramural lacrosse there. So when I was in med school at Penn, I played lacrosse for the Philadelphia Lacrosse Club for 2 years. And then when I got in practice here, the other doctor said, come play golf with us. And I said, there's no way they can reach me on a golf course if I have somebody go into labor. So I wound up learning to play tennis because the tennis courts were right next to the hospital. And what would happen, I'd be out playing tennis and the nurses would pull down the shade. That meant I had to go up and see a patient. So I was once playing in a tournament on those courts, and I lost to one of the kids from ESU, and I lost the first set. And right at the end of the first set, I saw the nurses pulling a shade up and down. That set meant move it, you know. So I went up there. I didn't have time to change. I had delivered the baby. I got some blood on my sneakers, and I didn't have time to clean them off. I went back and played the second set and third set, and I beat the guy. But he saw what happened. He saw the blood on my sneakers, and he said, what? I said, a little blood, and he got sick. And at that point, I overpowered him and won the match. So I wound up, I was county tennis champ, I think, a couple years. It was in the late 60s. And my best tennis loss was to Renee Richards. Do you know who I'm talking about?
No.
Renee Richards was the male who did a sex change operation and wound up after the sex change operation playing Billie Jean King and losing because at that point he was much older. But when I played him in a tournament up in at Tamerman, and he beat me 6-4, 6-4, but he was in the top 10 in the 35 and over in the United States. So I felt
It's a good showing.
a good loss.
Yeah, good loss. Interesting way to put it.
Yeah. Now that's my athletic career.
Well, you've been a doctor, you've been an artist, you've been an athlete. What other things have you done in Monroe County?
I was head of the Arts Council for 3 years. Linda Fort talked me into that, unfortunately, but I did it. I was a clinician for Planned Parenthood and was the president of Planned Parenthood in Monroe County for probably 3 years, and when they consolidated with Planned Parenthood of Pennsylvania, I was on that board for a while. I was briefly on the college board for a year till the governor replaced me with Lester Abelhoff, which was probably a good thing for the college because he had more money to give to the college than I did. I was for 2 years, 2 or 3 years. I was president of the Pennsylvania Lawn Tennis Association. I guess that's about it.
You're no spring chicken, I think you agree, right?
I'm no spring chicken, is right.
How do you stay in such good shape? How do you?
I'm still. I stay running an hour a day. It's more like a fast walk, mostly on a treadmill because I can hold on. I have a little trouble with my balance walking, so when I'm on a treadmill, I have handles to hold on, and I'm still able to do that. I guess that helps.
Do you have any big plans for the future? Are you going to take up another?
Well, I told Linda Ford at Stroudsburg that if I lived to be 100, I'd have another show then.
Okay. I'll come to that one. All right. Well, you've done a lot of things in your life. You've lived a very full life. It's not over yet, of course.
No, hopefully not.
Is there something I should have asked you about that we didn't talk about?
There are a lot of things I probably wouldn't want to say here, so it's just as well you didn't ask.
I have a question. You said that you had a funny story about the wooden wing at the hospital.
Oh, when I was a junior intern, that summer I spent here, there were 4 junior interns. And we'd rotate through the different services, and we were busy and we were working all the time, but it was such a great learning experience that you didn't mind. But we were so tired that at night you'd sleep through anything, and we slept on the 3rd or 4th floor of that old wing, and it was wooden. And we woke up one morning, the place was charred, there was smoke there. And I ran in. You could run into the newer part of the building, and I went into the what was the OB department, and I said, "I think there's a fire back there." Oh, and the nurse said, "Oh, you guys slept through it." He said, "The firemen were up here. They dragged hoses right past you. They put out the fire, and none of us ever woke up." Oh.
All right. Well, it's been a fascinating interview. I'll give you one more chance. Anything that we should have talked about?
I have one more. Do you piano?
Hmm?
Talk about piano too.
Oh, after I retired, I wanted to learn to play the piano.
At the age of 87.
Yeah, and I'll never be a concert pianist, that's for sure. But I'm playing big band songs from the 40s, songs from my teenage years. Yeah. And, they're recognizable, and I'll never be able to play at the Deerhead, but it's fun. And I took lessons for a while, and my teacher had a recital. And after a couple of years, taking lessons a couple of years with him, I said, okay, if I play in your recital? He said, sure. So everybody in the recital was between 5 and 17, and then there was me. And when he introduced me, there were about 7 or 8 women in the audience that I had delivered.
I thought you were going to say sorry,
But
I swooned.
I tell you, I was more nervous playing in that recital than doing surgery was easy. That was a snap.
How about that?
But playing in that recital, and I told Holly, never let me do this again.
No.
Do you play with other people at any time? Do you get together with another person and maybe sax player or somebody?
No. In one of my lessons, my teacher has a friend who was the lead in the Phantom of the Opera, and he came in during my lesson, and so he sang As Time Goes By, and I accompanied him.
No kidding. Wow.
And I made a couple of mistakes, but they overlooked it.
Well, you've lived a full life.
Yeah.
And you said in 1955, your son was 1 month old,
Yes.
right? Did you deliver your own babies?
Oh, no. Oh, you'd have to be an idiot to do that.
Why?
No, because you're emotionally involved and you're not thinking clearly. Yeah.
So who delivered your children?
Hmm?
Who delivered your children?
Dr. Horn, who was from Tannersville, delivered the first 2. One of the doctors in my residency delivered Melissa, who was the 3rd one, and I'm trying to think.
Somebody from St. Luke's.
St. Luke's OBGYN, Dr. Scutchus and Dr. Salage from St. Luke's delivered the younger 2. I have 5 great kids. 5 great kids.
Any of them follow you into medicine?
No, I have one who's physical therapist. Lori is local. I have one who's a retired science teacher, and he's retired, but he's still doing teaching gigs for other teachers. I have a daughter who's a lawyer for the National Wildlife Federation and is a national expert on wetlands. I have a son who never opened a book in high school, and I thought he was going to be working for McDonald's all his life, and he wound up getting a degree in architecture and an MBA, and he's in the process of buying his own construction company at this point, and will be the multi-millionaire in the family. And then my baby is a PhD professor at University of Illinois in accounting research. So nobody in medicine. The closest thing is Lori in physical therapy.
But they've all done well.
Yeah.
You're proud of them, obviously.
Oh, yeah.
And-
That's probably the best thing I've done in my life.
Well, that's a good note to end on, unless somebody else has another
That's
question.
wonderful. Thank you so much.
Yeah.
You're welcome.
Thanks very much. All right.